What we'll notice in the male reproductive system is a series of erectile tissue that allows the males to get an erection, which allows for increased probability of having pregnancy, right? For the males, we're gonna see that the males have the external anatomy that's slightly different than the females in that, all right, especially the testes is gonna descend further away from the actual body of the male. So the male has the scrotum area, which is the skin region right there, right, that is covering the testes. The testes in the male is divided into tubes where the actual meiosis occurs, and meiosis will produce sperm in these tubules. You cannot see the tubules here as you would need to get a cut. As you look at this region right there, so this whole thing's the testes, letter A, and then this region down here connected to the testes is called the epididymis. Epididymis is a region where the sperm goes and matures. And the epididymis contains lots of sensory neurons, and it allows for that increased sensitivity of the testes. The epididymis then connects to the vas deferens. That's that tubes right here, also called the ductus deferens. You can see the start right here is at the end of the epididymis, and it goes all the way up, and it allows you then to bring that sperm upwards so then it can be mixed with some of the fluid from the seminal vesicles. As it goes up, it helps form a cord-like region called the spermatic cord. So the spermatic cord includes the vas deferens, the blood vessels, which helps to cool the blood entering the testes. The blood vessels are called the pampiniform plexus, and muscles that allows us to thermoregulate. So you see the cremaster muscle up here. Down here is the dartos muscle, right? Allowing you to wrinkle the testes when it's cold, and then allowing the testes and the scrotum to kind of expel heat when it's warm by relaxing. The cremaster muscle up here allows you to bring the testes upwards towards the abdominal cavity, warming up the testes when it's very cold outside. When it's hot, after you've taken a hot shower, the cremaster muscle relax, allowing for the descent of the testes, so then the testes can be cool. Remember, to produce viable sperm, testes need to have cool temperatures, both in the blood coming in and with the thermoregulation. As we open this up region, as we kind of turn this area around, you'll notice that, right, you see the, right, up here, you can see, oh, sorry about that, right, you can see the ureter coming down, right, you can see the vas deferens coming around. As it comes around, it's going to receive some of the fluid from the seminal vesicles over here. Here's the seminal vesicles, and here's the prostate. Both help so that we can have a little bit of semen. You'll notice that as we open it up, right, you see the ejaculatory duct over here. The ejaculatory duct is where the sperm comes in from the vas deferens, then it's going to mix with prostatic fluid as well as some fluid from the seminal vesicles. It then enters the urethra. The urethra is named after the region it goes through. So this is a prostatic urethra. Then this is the membranous urethra as the urethra exits the abdominal cavity. Then it turns into the spongy urethra as the urethra allows for the passage of urine as well as semen and sperm out through the penis. This region right here, this gland, is called the bulbourethral gland, right here. The bulbourethral gland allows you to have a little bit of pre-ejaculate come in for lubrication. Now, as we look at the bladder itself contains a muscle called the detrusor muscle and the rugae that allows it to distend when there's more urine. Now, there are tightening of the detrusor muscles right here, and especially important in males, in that it forms the internal urethral sphincter. So during sexual reproduction, these two regions constrict, so then urine does not go through. Only seminal fluid and sperm enters. right? The fluid that exits here is called the, right, urine as it goes through, and then through the ejaculatory duct, you can have a mixture of seminal fluid from the seminal vesicles and sperm exit out. All right, now in terms of the females and the males, we see in males lots of erectile tissue. The two superior aspects right here, right, are basically erectile tissue that's split into two, and these are called the corpus cavernosus. Below it, you see the corpus spongiosus or corpus spongiosum. The urethra that goes deep to that is called the spongy urethra. This head region is called the glans penis. And then you have the prepuce right here, which is a remnant of the foreskin. The opening for the urine or for the ejaculate is called the urethral orifice. Now, the last thing I'll mention here, both in the males and the females, are the external anal sphincters. For the females, you can see it really well right here, and some of the muscles, right? In terms of the muscles, you will see the, right, superficial transverse perineal as it kind of crosses. You'll see the ischiocavernosus muscle right here, where my index finger is, and then the bulbar cavernosus muscle over here. In the females, the bulbar cavernosus also hides two glands, right? You'll see that you have Bartholin's gland, the small little bulb, and then the vestibular bulb that is slightly above it. Both of them are masked by the bulbar cavernosus muscle that is superficial to it.